Hello viewers, welcome to a special medical episode, and today we have named it Doctor's Voice. We know medical science has made tremendous advancement over the recent years, and today we have three senior consultants who will tell us about the recent advancement in their subjects. We have Dr. James Tan, Senior Consultant Urologist from Mount Elizabeth Orchard Hospital, Singapore. We have Dr. Liang. He is a medical oncologist and a senior consultant from Parkway Cancer Center, Singapore. And we have Dr. Ivan Ang. He's a senior consultant, a neurosurgeon from Mount Elizabeth Novena Hospital, Singapore. First and foremost, I would like to thank all of you for coming here this evening, and we look forward to hearing about the recent advancements in your respective fields. So I would like to introduce myself. I'm Dr. Zareen. I'm an anesthesiologist. I'm a consultant. I'm working in a private hospital. So my questions would be like, I would ask you only about the recent advancement that Singapore can offer to us. Okay. I would start with Dr. James Tan. My first question would be, why do you think prostate cancer is on the rise, and could you let us know why it is on the rise?
Prostate cancer is a slow-growing cancer of the elderly men. Right. Men above 50 years old have an increasing risk of having prostate cancer. So in many countries, like in Singapore, we're developing and country with an aging population, there is therefore an increasing risk of men having prostate cancer. Another reason is more and more people are seeking for health check, health screening, and as part of the health screening program, we are doing more cancer markers.
Right.
In particularly, I'm talking about PSA testing. So with this increasing use of cancer markers, we are seeing more and more people coming with abnormal PSA level. And when they further investigated, we are picking up more prostate cancer. So I think this is quite a phenomenon, not just in Singapore, but I think it's quite a worldwide phenomenon.
It's a worldwide
yes.
phenomenon. Okay. So what is the advanced diagnostic and therapeutic interventions that you do to treat prostatic cancer?
Now, prostate cancer in the early stage actually have very little symptoms. So the way we picked up prostate cancer is through abnormal PSA testing, or when they come to see us for some maybe mild urinary symptoms, when we do a rectal examination, we feel a hard nodule or abnormal irregularity in the prostate, which will then prompt us to do a prostate biopsy. And nowadays we are doing prostate biopsy in the clinic under ultrasound guidance, and then once it's diagnosed, we then subject patient to a very advanced MRI scan of the prostate and the surrounding area to see whether they have spread beyond the prostate. And once we are confirmed that it is an organ-confined prostate cancer, then we can discuss about treatment.
Right.
And if they present as early stage prostate cancer, the aim of treatment is always curative. In this case, we can offer the state-of-the-art radiation treatment or the state-of-the-art surgery. Now, between surgery and radiation, they have actually pretty equal, similar results in the first 6 to 10 years. But beyond 10 years, surgery has better outcome. Okay. And I'm very blessed to be able to offer patient robotic surgery, which is a very high-end, high-tech surgery, whereby we use a robotic system called the Da Vinci robotic system, and we look under the a high-definition screen, and we can perceive depth in the body, and we use minimally invasive instruments. Through a few keyholes, through the tummy, we can do the whole operation. And this minimally invasive surgery offers patient the following advantages. Number one, it involves small incision. Therefore, the pain level is much less than conventional surgery. The length of hospital stay is also shorter, and they get out of hospital faster, they recover and go back to work much earlier. Cosmetically, it looks nicer. It's a smaller scar. But more importantly, functionally, we can actually preserve potency by doing a nerve-sparing prostatectomy. And we can also preserve continence, which is a very scary thing for a patient undergoing surgery. So by minimizing potential side effect and complication, we can then offer patient curative surgery in a very safe manner. I think these are some of the advantages of modern technology.
Right. It's wonderful to know. I'm sure there will be a time when surgeons won't have to use their fingers doing a surgery. It's the robots who will be doing, and the surgeon will be sitting behind the computer and doing it.
Yes.
Yeah. Okay. So, Doctor, thank you, Dr. Lim. You are a medical oncologist.
Yes, I am.
Obviously, my question will be about lung cancer. What are the common causes of lung cancer?
Actually, there's only one important cause of lung cancer, that is cigarette smoking or tobacco smoking. Cigarette smoking or tobacco smoking increases the risk of lung cancer by 10 to 15 times. That is not 100%, 15%, that's 1,500%, so it's very high. So worldwide, if 100 lung cancer patients, 85 patients are actually smokers. So actually, if you can stop smoking, you can actually reduce the number of lung cancer by up to 85%. Passive smoking also increases the risk of getting lung cancers. Although the absolute increase of risk is smaller than active smoking, but it still increases the risk of lung cancers. The other less common risk factors for cigarette smoking is actually pollution and maybe exposure to radon radiation. But actually, there's only one important preventable risk factor, that's cigarette smoking.
So when a patient comes, say you have diagnosed lung cancer, is it diagnosed incidentally, or do they come, what are the symptoms? Like, what are the symptoms do they usually come with?
Unfortunately, for patients early lung cancers, they have usually no symptoms. So for patients who present with lung cancer symptoms, they are usually stage 3 or stage 4. And these are symptoms like cough, blood in the sputum, shortness of breath, or general symptoms like weight loss. So if you have a big lung with a small tumors within the lung, there will be no symptoms. By the time they cause breathlessness, it can be either due to collection of water in the chest fluid, that makes the patient stage 4.
Stage 4.
Or you can have severe obstruction of the airway, or you can replacement of a normal lung. So these are all symptoms of advanced lung cancer.
So usually they present with an advanced...
That's right. Yeah.
Okay. All right. So what treatment options, advanced treatment options do you have to offer them?
Okay, lung cancers, as in most solid tumor cancers, the treatment option, it depends on the stage of presentation. For early stage, stage 1 and 2, the lung cancers are treated by surgery, and the surgery will give the patient a chance of cure.
Right.
Unfortunately, only about 20% of all lung cancer patients are diagnosed in early stage, which are amenable to surgery. Traditionally, surgery, we go through a big incision by the side of the chest, 10 to 15 centimeters. So the problem with this surgery, for lung surgery, is prolonged cough and pain after the surgery. Like in prostate surgery, the recent advances is in terms of keyhole surgery, where the wound is much smaller, and actually patients recover very fast.
Right.
They used to stay in hospital for 1 week or 10 days. With a keyhole surgery, they can get up and walk out of the hospital 4 or 5 days post-surgery. In stage 3 patients, about 30 to 40% of lung cancer patients are diagnosed in stage 3 patients. These are treated with radiation. Again, radiation can offer the chance of cure for the patient.
Do you have advanced radiation, like more advanced technique in giving radiation?
Yeah, in terms of what has been doing the last few years is, because the chance of cure with radiation alone is still low, then we have been routinely adding chemotherapy concurrent with radiation to try to increase the chance of cure. Nowadays, the radiotherapy machines are very, very sophisticated.
Right.
What they can do is they can give a very accurate beam to a small part of the body.
Tissue. So
in fact, we call it stereotactic body radiation, where very small tumors instead of going through surgery, they can actually receive radiation.
And regress.
Yeah. Previously, the radiation would take 6 to 7 weeks. But with stereotactic body radiation, this can be accomplished over 4 to 6 fractions over 2 weeks.
Okay.
But again, these are probably not very routine now still, and usually for patients with small tumors that are medically unfit for surgery. But majority of the patients either present with advanced stage 4 disease or even at stage 1 to 3, some of them will recur and become stage 4. And the main advances in the management of stage 4 lung cancer patients are, I think, the availability of the newer drugs, and the big group is what we call targeted treatment.
Okay.
These are drugs that can be in terms of intravenous infusion or tablets, and the target specifically to the cancer cells, so that they are more effective and they do not affect the normal body cells.
Okay. Less side effects.
And less side effects.
Less side effects.
But just as important, availability of this new targeted treatment is our ability to test the tumors for the targets which these drugs are designed for.
Okay.
We used to give all this targeted treatment in a very non-targeted way, all lung cancer patients. Nowadays, with a better understanding of the tumor formation, we know which are the specific changes and we can test for them. For example, the drug gefitinib, we used to give it to all lung cancer patients, but nowadays we know it works very well and only works in tumor with the EGFR mutation, and now we can test a mutation. Now we can test additionally, we have a newer targeted agent called crizotinib, and nowadays we can test a mutation for this drug called ALK mutation. So I think for the future is availability of all these newer drugs, and just as importantly, the ability to test for the target, to test for the mutation, so that it can be really personalized treatment.
And also having very less side effects.
That's right.
Okay.
Yeah.
Thank you. Dr. Ivan, you are a neurosurgeon,
Yes,
but let me begin with neck and back pain. What are the common causes of neck and back pain?
The two commonest causes of neck and back pain would be, number one, a unaccustomed stress to the neck and the back in an individual who is not otherwise very active. Number two is in an individual who has, with the progress of age and a sedentary lifestyle, put on a lot of weight, and with the years, there is a lot of wear and tear in the spine, and all this leads to the increasing incidence of pain in the necks and the back. Traditionally, individual back pain is more common than neck pain. And the reason, of course, is that as humans in the city lifestyle, we are used to sitting, we are walking as an upright position, and the stress is all localized to the lower back. As a result of that, there's accelerated degeneration of the back, and if your back is already weak and potentially unstable, then an unaccustomed load may actually exacerbate back pain. Neck pain is actually a very unique situation, again, of city dwellers, mainly white-collar workers used to repetitive stress, working in an unaccustomed position, non-ergonomic furniture that they use, and all this all perpetuate neck pain. And of course, with the increasing stress of modern society, and the stresses, all this add on to exacerbate the pain, with all its attendant individual distresses and subsequent dysfunction in the individual.
So, what are the advanced treatment can you offer? And when do you actually require surgery?
The large majority of pain in the neck and in the back would be easily treated with rest, medication, and physiotherapy. And under this circumstance, 85% of individuals almost always recover without any long-term problem. Specific surgical treatment for spine would be only in very selected group of patients. And of course, this would be very severe pain in the back or the neck associated with signs and symptoms of nerve compression or spinal cord compression. And in these individuals, they not only present with pain in the neck and the back, they may present with pain in the arm or the legs.
Radiating
Pain, what we call radiating pain. Or they have got associated now numbness and weakness. Once there is a specific diagnosis where an individual has demonstrated symptoms of pain in the back associated with these neurological abnormalities, then the next step would be to do an MRI. The MRI is the gold standard for all conditions in the brain and the spine. And we now say that the MRI is part of the neurological examination. So personally, I would say that if pain becomes severe and is associated with neurological abnormalities, then an MRI is in order. MRI is exquisite and unsurpassed in its quality in detecting compression of the nerves. It is so, and the modern technology allows us to see individual nerve roots. We can tell whether the nerve roots are compressed by a disc or by excessive bony growth. We can tell whether the disc is desiccated or is dried up or is it soft, and so it's got huge amounts of information that we can glean.
Right.
It can tell us whether the core muscles are strong and whether whether your activity is going to be managed best by physiotherapy or you need an operation. And so the MRI is probably the key factor.
Right.
One of the considerations before we plan any surgery is the importance of congruence between what is a neurological symptom and the MR. Because of, as James and Hong Liang have said, the medical technology throws up a whole lot of information.
True.
And a lot of time, it's a signal to noise ratio that we have to analyze. Is the
symptoms together with MRI
related to that sign that you see on the MR? Because that is the key towards successful treatment. If you operate based only on the scans or treat based on the scan, then the patient unfortunately will not have a good result. I think that would pretty much sum up the treatment options. The diagnostic components. The treatment options for surgery are fairly varied and very tailored towards a specific individual spine condition. It ranges entirely from minimally invasive, what we call percutaneous needle injections, where we can give injections to the joints to relieve pain, down to the point where we can inject the disc and burn up the disc so that we can shrink the disc down. Those would be the simple procedures, almost like day surgery procedures. And even now with prolapse disc scenarios, we do almost like a day surgery procedure. We don't. The patient literally stays for probably only a day, and all that is because of modern development of technology. With better magnification and visualization, the incisions are very small. So, as there is keyhole surgery in most areas in the spine, keyhole surgery is exceedingly important because. Otherwise, conventional procedure is a muscle splitting, and muscle splitting, as you know, can be very painful and probably incapacitates you for significant amounts of time. Minimally invasive surgery in the spine allows you to achieve the same aim, but with better patient recovery. And of course,
shorter stay.
In individuals with instability now, being able to put screws to stabilize the spine and reduce pain becomes important. And down to the fact that in individuals with disc problems in young people, we can even replace joints. So we've been talking about joint replacements in the knee, joints replacement in the hip. We're talking about joint replacements in the neck now and the spine, which is now getting more and more common, particularly for young people who would otherwise require that amount of mobility for them to function. So the range is pretty wide. And the good thing is, of course, with the technology and the accuracy, we are able to do that in minimally invasive fashion. And that goes a long way towards helping patients get back to their level of function. And that's led to a massive
less hospital stay, less pain,
an explosion of spinal procedures worldwide.
থ্যাংক ইউ দর্শক মণ্ডলী, আমরা একটা ছোট্ট বিরতি নিব। তার আগে একটু সামারাইজ করি ওনারা কি বলেছেন। প্রথমে ডক্টর জেমস বলেছেন প্রস্ট্যাটিক ক্যান্সার সম্বন্ধে, আজকাল কি করে সার্জারি হয়, রোবোটিক সার্জারি হয়, যেখানে খুব তাড়াতাড়ি পেশেন্ট আরোগ্য লাভ করতে পারেন, কম হসপিটালে থাকতে হয় এবং ডক্টর লিম থেকে জানতে পারলাম যে লাং ক্যান্সার সম্বন্ধে কি করে এটা ধরা পড়ে, কি করে আমরা এটাকে ট্রিট করতে পারি এবং কি করে এটার আমরা বিভিন্ন স্টেজে কি করে তারা ডিটেক্ট করছেন। এবং ডক্টর আইভান থেকে আমরা জানতে পারলাম যে নেক অ্যান্ড ব্যাক পেন এটা একটা অনেক বড় ধরনের পরিসরে বলা হয়েছে এবং উনি বলেছেন মোটামুটি কথা যেটা হচ্ছে নেক অ্যান্ড ব্যাক পেন এটা তো যখন হয়ে থাকে তখন যদি সার্জারি দরকার হয় ওনারা এত মিনিমাল ইনভেসিভ অর্থাৎ এত ছোট ফুটো করে শরীরের মধ্যে স্পাইনের পিছে সার্জারি করেন যেখানে পেশেন্টের শুধু একটা দিন হসপিটালে থাকতে হয়, 7 দিন থাকার দরকার হয় না এবং পেশেন্ট তাড়াতাড়ি কাজে ফিরে যেতে পারেন। তো আমরা ছোট্ট একটা ব্রেক নিচ্ছি, ব্রেকের পরে আবার ফিরে আসব এবং আরও প্রশ্ন জিজ্ঞেস করব, সাথেই থাকুন। Thank you, viewers, for staying with us. We're going back to again the questions. Dr. James, why does one have recurrent urinary tract infection? But we know it's more amongst female, and why is it?
Recurring urinary tract infection actually is found also in men. The causes of recurring infection in men usually related to the enlarged prostate, a tight foreskin. But in female, the causes are usually maybe related to stones, related to a short urethra. Bacteria goes into the bladder easily, and that may be related also to sexual intercourse. So the job of a doctor like us to evaluate cases with recurring infection is to rule out things that are correctable, treatable, and depend on the symptoms. We divide the infection into upper tract infection or lower tract infection. Upper tract infection refers to infection at the kidneys and the ureters, and usually these are due to stones or some congenital abnormality like urethric strictures at the uretero-pelvic junction. It may be due to reflux of the urine up to the kidney. At the lower tract, may be related to a urethral diverticulum. So our job is to differentiate these two, because upper tract infection tend to be more serious. It presents with fever, and patient can die from that infection. Lower tract symptoms usually refers to infection in the bladder, and most people do not have fever, and they usually don't die from that lower tract infection. But it can be very disturbing to the extent where they find their quality of life drop severely. They find that they have trouble traveling, they have trouble concentrating on when you're working, and the worst deal is that it affects their sexual function. They don't even dare to have sex. It affects their marriage life. So we have to evaluate and see what's the cause. But the commonest cause, I think, is related to sexual function, sexual intercourse. Due to the short urethra, the area outside the urethra and vagina area has a lot of bacteria, and this bacteria usually comes from the rectum and the anal canal. And during sexual intercourse, the bacteria can actually crawl up and swim up into the bladder. And then this bacteria, commonly called E. coli, gets attached to the inner lining of the bladder. And some people are more prone to this infection. Studies have shown that some people have certain genetic predisposition whereby this E. coli gets attached to the inner lining more commonly than others, and that's why they keep having recurring infection. So the most important advice we tell our patient is to drink more water and to pass urine after sex. There are a lot of studies to show whether you should wipe from the front to the back or wipe from the back to the front, but there's no, these are not confirmed studies.
Okay.
But most important thing is to pass urine after sex. And if let's say for a woman in a year, they have 3 or more times of recurring infection, or within a 6 months period, they have more than twice infection, then we want to do more than just treating the infection when they come. We want to give them prophylactic antibiotics. We want to prevent the infection from coming. And we can actually give them antibiotics every time they have sex. Or we can give a low-dose antibiotics on a daily basis for 3 to 6 months, and usually it helps to break the cycle. Certain food and diet will help. Cranberry juice has been proven. Yes. It prevents the bacteria from attaching to the inner lining of the bladder. So they can take cranberry juice either in juice form or in tablet form. I think it's fine. On the whole, they drink more water. I think it will help resolve the issue.
Okay, thank you. Dr. Lim, we spoke about the diagnosis and treatment. So how curable is lung cancer? I mean, what is the longevity? I mean, I'm sure it depends on the stages, which stage it comes to. Could you just highlight on them? Yeah,
contrary to popular belief, we can actually cure lung cancers. A lot of lung cancers are cured. But what the chance of curing lung cancers or the survival, the duration of survival, depends on the stage. For example, for stage 1 and 2, where the tumor is still confined to the lung, treatment is surgery. In those cases, the aim of the surgery is for cure. So for patients who are curable cancers, we don't talk about how long do you have, but rather that what is the chance of cure.
Right.
On average, for patients who have stage 1 and 2 who undergo surgery, the chance of cure is probably about 50 to 60%. Some of the good stage 1, the cure rate can be 80%. Some of the bad stage 2 can be 40 to 50%. But if the cure rate is 50%, what happens to the other 50%?
Right.
They recur. They may recur in the liver, they may recur in the bones 1 year, 6 months after surgery. So the question is, why do they recur?
Right.
We have done the CT scan, the bone scan, the PET scan, and it shows no tumors in the liver, but yet 1 year later they appear in the liver and call it recurrence. In this sort of cases, actually, the tumor cells has already spread to the liver. It's just that there are too few cells that we cannot pick it up with the current scans. So we do the surgery, and 1 year later they grow to big enough cells, big enough size in the liver, and call it recurrence. And because of this, nowadays we actually recommend adjuvant chemotherapy. That means chemotherapy after surgery for patients with stage 2 or 3.
Okay.
After the surgery, to try to eradicate all these cancer cells that may have already spread. And adjuvant chemotherapy can actually reduce the risk of recurrence, thus increasing the chance of cure. For stage 3 patients, where the tumors is locally advanced in the chest, they may involve the lymph nodes around the airway, invaded the tissue around the lung, but they still confined to the lung. These patients, the treatment is by radiation. And the aim is still for cure, but unfortunately the cure rate for radiation alone is low, maybe 5, 10, 15%.
Okay.
And again, to increase the cure rate, we add on chemotherapy either before or if we can together with radiation to try to increase the chance of cure. For those patients stage 1, 2, 3 who have recurred, or for those patients we present with stage 4 lung cancer patients, stage 4 meaning that the tumors have spread through the bloodstream and gone outside the lung, maybe in other parts of the lung, the bones, the liver. These patients with treatment we are presently unable to cure. So for this patient, the aim of the treatment is try to control the disease for as long as we can to prolong the survival. Just as importantly is to manage and alleviate the symptoms so that they'll feel well and also prevent complications. About 10 years ago, just 10 years ago with the conventional chemotherapy, the median survival for all these patients was about 1 year, and less than 20% will be alive at the end of 2 years. Okay. But nowadays with the newer treatment, especially with those with a certain mutation and with appropriate targeted treatment, this group of patients, the median survival has actually doubled from 1 year to more than 2 years, and the chance of being alive at the end of 2 years is actually more than 50%. So there are a lot of things, so contrary to popular belief, a lot of lung cancer patients are actually cured, and if they're incurable, a lot of them can be managed and controlled for a long period of time.
And they can lead a near normal lifestyle.
Yes, the good thing about those targeted treatment is they have very little side effects. They do not have the usual side effects of chemotherapy like hair loss. They do not affect the bone marrow. They don't reduce the immunity, and they seldom cause nausea or vomiting. So patients are actually very well.
Okay.
The most common symptoms, side effects, actually the skin. Some of them, they may have a bit of dry skin, the skin itch, pimples, but usually they are well tolerated.
Well tolerated. Thank you. Dr. Ivan, now, since you're a neurosurgeon, I have to ask you about brain. So what are the common tumors of the brain now? When somebody says, well, when we come to know somebody has a brain tumor, and the next thing that comes to our mind is it's over. He or she is not going to live. So could you just highlight, about brain tumor? What is it's like cancer having no answer. Does it have any answer?
Yeah. I think you're right in the sense that when somebody is diagnosed with a brain tumor, I think the world literally falls around them. Yes. They're not only concerned about survival, they're concerned about the very essence that makes them human and what makes them dear to their family and what it means for them in their work. So it's a huge thing. One of the things about brain tumors is that we are seeing a lot of brain tumors now because our medical colleagues in oncology are keeping so many people alive now in their treatment that 10 years ago we see very few individuals with brain tumors that from other parts spreading to the brain. So when we talk about brain cancers, right? Brain cancers would be primary brain cancers and secondary brain cancers spread from other areas. And we used to think that with primary brain cancer, secondary brain cancer, the results are very dismal. Certainly if it was secondary brain cancer going to the brain is stage 4, you're pretty much done and you probably should pack up, go back home and lead the last few days of your life quietly. But we now know that with secondary brain cancer, even with secondary brain cancers in the head, the treatment is extremely gratifying, provided our oncology colleagues tell us there's very little tumor load in the body. Okay. So if a secondary brain tumor that is not treated becomes life-defining for the individual, but if it's treated, then these lesions may not become defining if the tumor load in the body is low. Okay. So that becomes very significant because it does not mean that if you have breast cancer and you got now metastasis or spread to the brain, you cannot be treated. We used to only consider radiation, and whole brain radiation has always been conventional if you've got multiple brain lesions. But nowadays, we are able to give very targeted treatment called the gamma knife, what we call radiosurgery. Radiosurgery is a principle very much like surgery, except that you use the principles of surgery to kill the tumor. The concept of radiation is you use multiple doses to control the growth of the tumor. And so in that sense, it is not really curative. But radiosurgery acts like surgery in a sense that without using the knife, you can literally kill the tumor with gamma knife. And gamma knife is actually very, very effective.
Can you just say more about the gamma knife?
Yeah, the gamma knife is not exactly a new tool. It was invented 30 years ago, and so the data has been very accurate. There's been accumulating data. It is now pretty much gold standard. If you've got a tumor that's less than 3 centimeters in the brain, and you've got more than 1 lesion. If you've got more than 1 lesion, then the gamma knife is used to treat them. It's a very simple procedure, outpatient. You have a frame put on the head, get a scan, and have a cookie while the neurosurgeon does a bit of the planning, and then you sit down, get a scan, and you're good to go for your golf game at 4 o'clock. And that has been the significant amount of downtime. And what it does is that basically it kills the tumor, and of course, in that sense, prevent any further growth that will destroy your brain and affect your neurological function. So that is for malignant tumors. The rest of the other set of tumors that we have in the brain are actually benign tumors. And benign tumors will constitute probably about 60% of all tumors. And a lot of the times we think that, well, benign tumors in the brain are not significant. On the contrary, benign tumors can also kill because the brain sits inside a rigid skull. And if you have a large tumor that is growing, it compresses on critical structures and can be potentially risky. The option for treatment, the good thing about most brain tumors, benign tumors, is that with the technology that we have now, most tumors are easily resected with minimal morbidity if they are, for example, superficial, and if the patient has very little neurological deficits. Of course, once there is a neurological deficit, i.e. the patient is paralyzed, sometimes surgery may not improve the function because brain function is not like, unfortunately, other organs. They have very little regenerative capability. So the aim is to be able to deal with them very, very early and get them and resect the tumor as much as possible to institute cure. So 20 years ago, that would pretty much be a death knell for most people. But I think today, there's a reasonable chance that you could still be reasonably functional after you've been diagnosed with brain tumors. While it is not necessarily all
tumors are malignant.
Favorable. I mean, we have got a long way to go. There's a small group of tumors for which we have no answers for, and there's the primary brain tumors. The survival, again, even with the best treatment, is 1.5 years, 2 years, and this group remains a very difficult area to treat. So there are individuals that can do well, but of course, as you can imagine, in brain tumors, not everybody gets through the door.
Thank you. দর্শক মণ্ডলী, আমরা প্রথমে ডক্টর জেমসের কাছ থেকে জেনে নিলাম ইউরিনারি ট্র্যাক্ট ইনফেকশন মহিলাদের কেন হয়ে থাকে। ডক্টর লিম থেকে জানতে পারলাম যে লাং ক্যান্সার হলে কিভাবে তার ট্রিটমেন্ট হবে, কতদিন বাঁচবে, এবং ডক্টর ইভান থেকে জানতে পারলাম যে ব্রেন টিউমার, সব ব্রেন টিউমার ম্যালিগনেন্ট না, 60% বেনাইন, কিউরেবল, সম্পূর্ণ কিউরেবল না, বাট নিয়ার নর্মাল লাইফ লিড করা যায়। যদি নিউরোলজিক্যাল ডেফিসিট থাকে, আমরা জানি ব্রেনের সেল রিজেনারেট করে না, তখন হয়তো কিছু করা যায় না, বাট 10 বছর আগে যা ছিল এখন তার প্রগনোসিসটা একটু বেটার। একটি ছোট্ট ব্রেক নিচ্ছি, আমাদের সাথেই থাকুন। Welcome back, viewers. Now we are almost at the end of our program. I would ask Dr. Tan, Dr. James Tan, could you say a few things to the viewers as regards how to take precaution not to have urinary tract infection and how to protect your prostate?
Okay, with regards to prevention of prostate cancer, we know that the risk is related to age, and it's also related to your genes. For we know that if your father or a close relative have prostate cancer, your risk of prostate cancer increases by 2 to 3 times.
Right.
So you cannot prevent your age from going higher, nor can you change your genetics. So there's really nothing very much you can do in terms of preventing prostate cancer. But you can prevent presenting to the doctor at a late stage.
Right.
So therefore,
early detection.
We are talking about early detection, and we know that there is no increased risk in prostate cancer that's related to like vasectomy or the frequency of sexual intercourse. These are all myth. It's basically just age and certain genetic predisposition. So our recommendation is to go for an annual health check, which includes a PSA testing, a rectal examination when a man reaches age of 50. If there's a family history of prostate cancer, then you should go for a check at age of 40.
Right.
And then coming back to urinary tract infection, I think increasing water-free intake helps. Cranberry juice helps, and passing urine after sex will help. And try to avoid holding the bladder for too long. Sometimes it overstretches the bladder, leads to bladder dysfunction, incomplete emptying. All this leads to stasis of urine in the bladder, and all this may lead to urinary tract infection.
Okay, thank you. Dr. Lim, how can we look after our lungs?
Okay, contrary, as opposed to cancer of the prostate, lung cancer is a highly preventable cancers. As worldwide, about 85% are related to cigarette smoking. So the best way to prevent lung cancer is to stop smoking if you are smokers, and if you are not the smokers, don't start. But similar to the prostate cancers, it's just important to present early, the early diagnosis. The suggestion, if you have a new cough that lasts more than 3 to 4 weeks, and seek medical attention early.
Early, right. So early detection.
That's right.
Dr. Ivan, so how do we prevent neck and back pain?
I think the process is simple. Maintain consciously good posture at all times. Stay fit, and so that basically you build your muscles, and stay lean so that you don't have to carry so much weight.
So much weight.
Yeah,
right.
that pretty much will be it.
Thank you. Well, I must thank all of you for taking your time out and coming to our studio, and we are extremely honored that you could find time for us, and of course for our viewers to enlighten them with your recent advancement in your particular subjects. And I wish you a safe journey back home, and hope to see you soon again.
Yes, indeed.
Sure.
Yeah.
Thank you
very much.
দর্শক মণ্ডলী, আমরা অনেক কিছু জানতে পারলাম আমাদের তিনজন স্পেশালিস্টের কাছ থেকে যারা সুদূর সিঙ্গাপুর থেকে এসেছেন। prostate cancer, urinary tract infection, lung cancer, neck and back pain, brain tumor. আশা করি আপনারা উপকৃত হয়েছেন। আগেই বলেছি রিসেন্ট ইয়ার্সে মেডিকেল টেকনোলজি এত দূর চলে গেছে যে আজকাল ক্যান্সারের কোনো আনসার এটাও বলা যায় না। সব রোগেরও চিকিৎসা আছে, উন্নত চিকিৎসা আছে। সবাই ভালো থাকুন, সুস্থ থাকুন। এই নিয়ে বিদায় নিচ্ছি। আমি ডক্টর সেরিন মাহবুব।
Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care, Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.